Hello, friends. I am Beth Mehaffey, and you are here for Unfiltered Veterinary Discussions. I am joined today by two of my coworkers from my hospital, Pennridge Animal Hospital. I'm here with Sammy and Kira, and we'll give the official Unfiltered wave. So for those of you who are new to our podcast, it is available on all streaming services. So please check us out and follow along. But today we're doing sort of a special one. That's why it's just me and not the whole Unfiltered team, because we are talking about a program that we started at our hospital that these two lovely ladies were very integral in getting up and running. So I wanted to have them share some of that information with all of you, because I think it's something that most hospitals could benefit from. And what that is a grief program. So I feel like we deal with so much grief in this field, whether it is consoling each other with a difficult case, consoling the clients, dealing with emotion of just personally with an animal that you bond with. Like, there's a lot of grief. So we felt like there was a big need for that. And that is something that we have since started at our hospital. So we're going to talk about it so we can give you guys some pointers on how it might be something that you want to do at your hospital. So Sammy, I'm going to start with you. So Sammy is probably one of the main reasons we have a grief program. And it's something that's really important to her, but I want her to tell you a little bit more about her why and why she thought this was something that was important to do.
Yeah, so I'm Sammy. I've been a vet tech and at this specific practice for the last 9 years. So I've seen a lot over, the course of those years. And I've grown to really love those geriatric, senior patients, just seeing them waiting in the waiting room or just greeting with their sugar-coated faces. They're just so, they're genuine to begin with, the animals, but they're just, the older ones are just so special. And as they get older, they need us more. Typically they need us more than, in their younger ages. And, I just have always wanted to give them, go a little bit more for them and the extra care and comfort that we're able to provide them. But, not only that, but then it came, the idea of a grief program kind of came from that, because not only is it for the animals, but it's for the families. And I felt that, through every step that they need, support, that's kind of what I was there's something there that, people could really, benefit from. And I think that, I obviously love animals, but, I really love supporting their people too. So that's kind of what, why this kind of sparked for me.
And I feel like you'd both agree that a lot of people say losing a pet is harder than losing a family member, right? I feel like people say that all the time, yet there's very little support for loss of an animal, but they're with you every day. That relationship is just naturally going to be different. Not that it's more important than a parent or a grandparent or what have you. It's just different. It's a different loss. And Kira, I know that this is something that's been really important to you too.
Yes. So I'm Kira, and I've been in the veterinary field for 23 years now. And
don't age yourself.
Oh my. And I've been at this practice for a little over 11 years, and I learned very on as a baby tech that this was really just a very unique area for what we do. And in many, many ways, on our own end, dealing with our own grief and being so close to that multiple times a day, but then also having to be there for the clients and deal with their grief, and then turn around and go into a puppy appointment or a kitten appointment. And one of the like Beth was saying, one of the things early on too in my career, I did a CE, and it really resonated with me because the speaker talked about how losing a pet is so different in the fact that you, for their entire life, they rely on you for absolutely everything. From the minute they wake up, to feeding, to medicine, to going out, they rely on you, you rely on them. So it's truly, I lost my my Soko in October, and he was 16. And like I took care of him for 16 years, all day, every day. So it is a unique loss in that it completely changes you, because they were part of your life for either a short time or a long time. And it's very difficult, I think, for a lot of people to understand, whether that's you as the person who lost that pet, thinking like, oh my God, it's just a dog, it's just a cat, it's just a rabbit. And then something Sammy and I had learned about recently, you know, just people that you even think would provide that support to you don't always understand.
Yeah.
And that, I think, is kind of where we come in these grief programs, is to just sort of help the pets 100% be there for them, but be there for their owners through that whole process, and just be like, it's okay, like to feel the way you're feeling, like that's totally okay, and we're here to support you in whatever way we can.
And to provide a space really for people to feel that grief, because I feel like it is, like, I don't want to say taboo because that's not like the right word, but it's almost like, unless you work in the vet field, you're supposed to put your best friend to sleep by choice, which is a heavy decision, and then literally show up at work the next day and be fine, and not be able to express that grief or talk about it. Or if you do, like, people are like, that's weird, who either don't have pets or have like squashed their grief down because they think that's like the social norm. So trying to create a safe space for people to be like, I am not okay about the loss of my dog, and I want to talk about it, and it's bothering me for months. There are people that have come to some of our grief sessions that are like, felt this way for months and felt like they couldn't talk about it.
Right. I mean, even just at our most recent support group, like, people were saying, like, you know, at work, when they went to work later that week, people were like, well, why are you so upset? It's just a pet.
Yes.
Just a dog, just a cat. But they don't understand that it's not just an animal to people like us and people who have that really deep bond with their animal. Because, like Kira said, they rely on you solely, and you are their caregiver, and they give you purpose for every day of your life.
Right.
And if something, you know, that happened between the time that you guys were together, like, say, like, you lost someone, like, you know, family member, or someone was really sick in your family, they were there for you. They were your constant. And, you know, even though it's unspoken, it's a deeper bond, and that's what brings us even closer to those animals. And like, some of us have our soul or our heart animals, like, because some of them are just a little bit like closer to us in that bond, because they've been through something so, you know, tragic, or even just happy things too. Like, you know, you had, you know, brought a baby home, or, you know, got married. They're a part of that too. Sure. And, you know, when that chapter comes to an end and you have to make the decision to let them pass on, you know, that's really heavy, and it's not, you know, something that just goes away the next day. I mean, like, it's very, I don't know the word other than taboo, but like,
it's like not socially acceptable to grieve for your pet publicly for more than like a day.
And that's like why,
which is not right.
Saying, like, you know, they feel so alone during that time, because they don't feel like they have that space to grieve.
Right. Agreed. So we've established the need is absolutely there.
Yes.
So then I think we can also agree this is something that maybe in vet med we could do better. Like, I feel like providing more support for people, even internally, because us as people who work in the field take on the burden of our clients and the grief of what that feels like for them, as well as then personally having grief either for a beloved patient that you lose or when you lose your own pet. So it's like a layered heaviness for those who work in this field too. So we know the need is there, and we know that it's needed internally and externally. So what I'd like to pivot to now is like, how do you do this? Where do you start? So if you or someone who's listening to this is like, yes, this resonates with me, where do you start to try to get a program going to provide more support for your team? Sammy.
So I feel there's kind of like, you need like a person or a small team of people who are very dedicated and, you know, understand that this is a need and want to make it, part of a practice.
Yes, you need a champion.
Yes, you need a champion.
Yeah.
And so, you don't have to start super big. Like, it's okay to start small and just recognize that you have a need, put a team together. And then what we did here at our practice was, we gathered, a few people who were interested. We do have a comfort room in our practice. So we kind of, there are a few people that took that under their belt of really kind of revamping that, making it very comfortable. We have a nice couch and chairs. We have human comforts as well as pet comforts. We just really made it something that, it's not just a exam room that, that's kind of all there is. We've made it very comfy and, kind of like home, feel.
Yes.
Like that.
And it has a totally separate
Yes.
space and entrance and exit, which I know that it will not be realistic for everyone, but that's really nice because then people don't have to wait in the waiting room.
Yeah.
Even just the flow of how the appointment goes, I think matters.
It's very private.
Yeah.
Which is good too, especially because, that's a private moment.
Yeah.
Agreed.
So we, had a small team doing that. I took a lot of kind of the handout and resources kind of under my own belt. A few of the other team members did share, other, if there was another practice or another, organization that had a good handout that they wanted us to kind of, use at our practice. I did a lot of research with, Lap of Love, CADA, the animal bereavement. I looked at what they had to supply their clients, whether it was quality of life assessments or just general information on anticipatory grief, because that's a huge thing that we see from our clients. Just supporting them through the whole process, because some people have never been through euthanasia or decision making before. So kind of just figuring out what our client, listening to what our clients were in need of, and getting those resources to be Pennridge Animal Hospital. So I took a lot of information from a lot of different places and kind of meshed it all together, presented it to that the main team here, and then slowly introduced it to our staff to, because obviously you need not just the champions that lead it, but also then your staff needs to be involved. So they're able to refer, clients to certain handouts or assessments, and then be able to, produce that to the rest of the clientele.
Yeah. And what would be a couple of examples of those resources? If you could think, because I know we have one that's how to talk about loss with children, because that's one that comes up a lot.
Yeah.
People how do I tell my kids?
Yeah.
I know we have one on anticipatory grief, which if you're not familiar with that term, that's basically when you have an animal that is declining or not doing well, or has just been diagnosed with something that they're kind of hospice or palliative care, the waiting period of knowing you're going to lose them. I feel that anticipation is hard, and a lot of people don't talk about that. People deal with that with human loss too. That one, I know we have handouts on that, and just understanding grief in general, the stages of grief,
facts,
and what that looks like.
we have the different assessments. So we have a canine versus a feline assessment. We also have a caregiver assessment, because we often, as humans,
And these are quality of life assessments.
quality of life
scales.
assessments, where you're yes, no, and then at the end it's kind of a tallied, scoring, and it kind of shows you where your pet is or where you are, because as us humans, we forget that we're just as important, as our pets, that our quality of life, if it's not great, it will affect our pet's quality of life too.
Yes.
Agreed. Yeah. So those were kind of the main ones that I felt were very important to have to at least start, and then kind of
Build from.
Yeah.
Yep. Agreed.
I do think those scales especially are super impactful, because sometimes, even if someone didn't fill it out, it asks you those questions that maybe you hadn't been thinking about, like in regards to your, your cat or dog or whatever, animal that might be. And then there's the questions about your quality of life as a caregiver. And sometimes it's just very, just even reading those questions and you're like, ooh, I didn't actually think about that. And, perhaps, when CME created those scales, and I like to read the handouts and do them to see okay, well, what that would look like. And that was at the same time that Soko wasn't doing well. And I did the scale. And even as someone who's been in this field for a really long time, I was like, oh, sometimes just answering those questions and seeing it helps even us who've gone through this process many, many times. So I think those scales are super impactful on both ends for clients.
Right. And I honestly feel like half of dealing with grief is the making the decision to let them go. And that's where I feel like even if your hospital wasn't ready to add all the after they're gone support, which I still think is super important, I think you could even be doing your clients more justice if you did a really good job of the help leading them up to letting them go. Because providing support for that, how to make the decision, when to make the decision, having resources, having team members who are comfortable talking to them leading up to the loss, I think is super important. Then the actual experience, where Sammy was talking about what our room looks like, that it's a comfortable space, there's usually gentle music playing, it's very private. I think that's really important because we've heard so many horror stories of a dog on a cold exam table where the vet brushes in and then brushes out and it's a terrible experience. I feel like that's what sticks with people because it's already one of the worst days of their life, right? We should be trying to soften it. And then there's the after part of dealing with the grief once they're gone, which is sort of the next part, I would say, is what we then move to.
Yeah. So it's kind of what scope do we want this program to become? Do we just want that up until, no, because grief doesn't end there.
Right.
So we decided to start implementing in-person support groups. And it's important to, know that there's a boundary. It's not therapy. It's just support. Because we're, just very professional, not just.
We are not therapists.
Yeah,
so Kira plays one sometimes
in her role. Yeah, she has many hats. But it's a space that we wanted to create, and we use our waiting room on Sundays. Specific Sundays that we don't have normal office hours. So it's just a few of the staff members, the three of us, go to the program or the support group, as well as a few others for grief support kind of management team. And then we have, leading up to that specific day, we have, social media, posts and whatnot to be hey, we are supporting or want to support you in your time of need. So we, picked, I would say originally we were going along with let's have a theme for each session. And Beth had said, anticipatory grief was a huge, kind of unknown.
Yeah.
Phrase,
undiscussed.
Yeah.
It's there, but I don't feel like it's talked about a lot.
People don't know that that's what they're feeling.
Right.
So, we're okay, let's have a support group, because that's really important. Let's have a support group on anticipatory grief. And so we set up a group to, I feel like I'm rambling right now.
That's okay. You're fine. So the first one was going to be about,
it
was
about anticipatory grief. And, we send it out to our clients, let them know this is a new program, but, we want to be here for whoever needs it. And we asked for pre-registration just so we kind of had an idea of what, how many people are going to attend. And it just kept rolling in. There were so many people signing up, and I was oh my goodness. But I'm kind of like going fast forward here for a moment, but it just showed how much of this need was. So it, reaffirmed that, okay, like this program is super important to have, if you have the ability at your practice. So, we met on a Sunday. It was very kind of, even if you did sign up, you didn't have to come. If you felt, that morning you weren't ready, if you did show up, you didn't have to talk. It was just a space that we wanted to host that was very safe, very judge-free, that people who didn't realize that they weren't alone, because like we mentioned, like it feels very, like pet loss feels very lonely. We just wanted to create a space for people to come be amongst others who have that or had that bond with their pet that they lost recently, 6 months ago, haven't lost yet, but they're in that anticipatory stage, just so they could kind of share that same space with one another and feel that support.
And I feel like it went very well.
Yeah.
I think people super appreciate it. You were at that first one.
Yeah, I was at the first one. I couldn't make the most recent one. Sammy did an amazing job. I'll say that right off the bat. Leading it, and we did do a practice run with the team first, like to get our feet a little bit, wet since it was the first time.
Yeah.
People were very receptive, and they're all varying degrees of comfort, sharing experiences, and we know, and your clients, and there's even some, where you're like, oh, I expected that, and then there's some where you're like, I had no idea, like that this particular client would even join us. So it's it is important. It's a nice safe space to let people either just listen or participate and just sort of be in the moment and take from it what they need in whatever part of the process they're in.
And so the first one was a little bit more structured, and kind of went over some of like what grief looks like and touched on anticipatory grief since that was sort of the theme, and then had some time for open discussion. But then with the second one that we just most recently did that Sammy and I were at, we changed the structure a little because we had gotten some feedback that people almost wanted it just more open-ended. So like there were resources there that people could take handouts on the stages of grief or understanding grief and the different types of grief. But then as far as like leading it goes, right, we pivoted a little bit.
Yeah, because as the main support team at Pennridge, we were like, okay, let's have themes for discussion for each one. And we're like, great. So the first one was the anticipatory grief. I had sent out an anonymous survey afterwards, as we had a sign-in sheet too, just to kind of gauge like who was there, who they were honoring, and if they want to share, and if they were okay with us sending the survey after. And a lot of the feedback was very positive, and I mean it was all positive, but a few people had mentioned that they would have liked more time to share, and like Beth said, it was very structured and it was more educational, because I feel like, the first time too, I didn't really know what I was doing.
Right. Well, we didn't know what to expect.
Yeah.
So I feel like that's fine.
And a lot of people did say they, afterwards they were like, I didn't know it was like anticipatory grief, or, that's what I was feeling. So they did really appreciate that information, but I think some people who were more comfortable sharing did want a little bit more time. The week before, and I was kind of struggling with making the outline too for the second session, because we were like, okay, let's now do a topic of making the decision and the quality of life assessments. So I was kind of struggling with that because I'm like, it's very dependent on who shows up, who wants to say, what they're feeling in the moment. So it's kind of difficult to have a structure, and it's fine to have that just, in case you need it. But support groups are supposed to be just to share what you're feeling.
Yeah.
And it can be different from, last week to this week. So Kira and I actually attended a session hosted by Pet Loss Community, which is they're amazing because they also recognized that pet loss is a very unique thing that, there's not really a lot of support. So they are just for pet loss. And we met with the one girl, Haley, and she had invited us to a session. And it was a support group. They do their Zoom because they're kind of based kind of all over the US. And I got a lot of a lot more understanding for what that support group should look like.
Yeah.
The host kind of opened with acknowledging if she knew someone who had previously been there, welcoming everybody, and then kind of just let people talk. And I think that was super important. It's okay for there to be pauses and silence because people are just processing. And if there was a little bit more of a lull, she had a prompt that she would, even if no one answered the question or the prompt that she had, it at least got those attending kind of thinking about, what she had asked. Yeah. So I felt that was a lot more meaningful and intentional than being okay, let me follow this outline.
Right.
And so then for the session we just had last weekend, I feel like I sent out a survey again after, and the feedback so far is saying, that they really enjoyed having that time to talk and have that kind of peer-to-peer interaction too, which was, as the kind of facilitator and just kind of the people who are heading this program, it was just kind of heartwarming to see that, clients who don't even know each other are there to support each other too.
And it was really cool to see someone would say, one of the people was talking about how difficult the decision was and then how much she's still grieving. And one of the other people that attended was and that's okay. It's okay that you're still grieving. So it was just nice. We were there to sort of facilitate and support, but it was nice that there was even just interactions of the people who attended supporting one another, which is cool. I feel like that was really
that was heartwarming.
It was. Yeah. It was. So really, I feel like if you were going to try to start this program, there's a couple different key things to think about. So, and you guys can interject if I'm missing anything. So one is what resources do you have for your clients? So I feel like that is a pretty easy place to start. There's a ton of websites and veterinary specific resources out there that you can start to look at. And even with this podcast, we can probably share some of the websites that we've used, that Sammy mostly did the research on, to give you somewhere to start to get some of those quality of life scales and stuff together. Because even if that was the only thing that you could do a little bit better, I feel like providing resources on helping people make the decision, and then also understanding grief a little bit would be a really good place to start. And then what does your euthanasia process look like? Maybe spend a little time trying to make that room or that space comfortable. Even if you can't have a dedicated room, can you have a cart or something that you roll into the room? Can you make sure that every room or every area where you do the euthanasia has some soft touches to try to make that a smoother or more comfortable process for the people in the family that is losing their pet? And then that after support, whether that looks like additional resources or you want to try implementing something that would be a group program where people can come. I feel like that kind of varies hospital to hospital, what your focus is, but I think it is something that people are very interested in, that even if you can just educate them on some of the other websites that they could go to, if your clinic is not ready to host their own, there are some out there if you do a little bit of digging. I feel like there's a lot of options. So if you were going to give people one piece of advice for starting it, what would your piece of advice be?
One piece of advice for starting it. I really do think the biggest piece of advice for starting it is having at least one person who they're yes, because without that one person like Sammy, really being I love this and I'm passionate about it and I want to make this the best that it can be. This is not something you want to do half-hearted. So like, if you want to do this for your practice, having that one person really be that force behind it to help it really just get up and going, because there's so many little touches that, like, yes, like we have that team, but if Sammy, who leads it, wasn't on top of those little touches, they would fall, you know, through the cracks. So that's my biggest thing for starting it for your hospital.
I agree. That's a really good one. Sammy, what about you?
I would say don't overthink it. Like, you are a veterinary professional. You already are familiar with the process that goes, you know, through, you know, kind of start to finish and after. Like, you already know kind of what your clients need. So you have that information already. You just, you know, need to have more of like a plan and like even like a small team to help you implement it. So and starting small. You know, don't feel like you have to launch this big, like, extravagant program right away. It's okay to just kind of, like Beth said, like, even just starting with the small, like, resources that you might not currently have at your practice. I think that's important.
I mean, even when we first started, before we had like a comfort room and stuff like that, like, we made sure that every single one had a big comfy blanket or a big bed, and even the chair that was in the room for the client was something more comfortable. Like, even starting somewhere super small like that, like, and then we grew from there. But like, even from the beginning, it was something very small, but it's very impactful.
Agreed. And like the little touches, like having, like, we have a jar of Hershey Kisses, so people can give like a final kiss, and we have, we'll make people ink prints that we just have like ink stamps, and we'll make ink prints and nose prints, and we save our like Bordetella vaccine jars and make fur jars. Like, there's all little things that if you start doing some research about it, and those are the things that like stick with people. And the last thing that I want to touch on is two things actually. So one would be that even though this feels a little bit like an ancillary service, that if you're in the grind of the day-to-day, like, does it really matter? It does. And the reason that it does is because if you leave that client feeling loved, cared for, and supported at the end of their pet's life, and they get another pet, where are they calling? So I think that sometimes we forget that end of life care is just as important as those first puppy kitten visits in ensuring that that client feels supported from the very beginning to the very end, which is only going to help your business, because that is going to help with client retention. And when those clients are getting new pets, or when they're talking about what a wonderful support experience they have, that's going to help you get new clients. So just to take off my compassionate hat for a minute and put on my business hat, like, it does benefit your business. Absolutely. I feel very strongly that it does. And the second thing is, don't forget to support your team, because your team, those internal clients, as I like to call them, they sometimes don't know how to deal with grief either. And they don't know how to work through those feelings. And like, why do you think veterinary medicine has such a high mental health crisis? Because we deal with really heavy stuff on a day-to-day basis. Where, like Kira mentioned in the beginning, you have to go in a room where you are helping someone put to sleep their best friend, where they are literally sobbing and it's the worst day of their life, and they're saying to you, I don't know what I'm going to do without this dog. And you have to cry. Well, you do cry, because who wouldn't cry? And then walk out of that room, splash some water on your face, and go in the next room with a kitten and act like you're fine. And that is not normal behavior. You should not have to do that. And we have to do that in our field. And it is okay. And we compartmentalize and we figure it out. But that is why this field, one of the many reasons that this field struggles with mental health, because we deal with heavy, heavy shit. And a lot of us don't know how to deal with it. So I feel like we also, which we didn't talk as much about, but I wanted to at least plug it, have done a bunch of resources for the team too, of helping them work through grief and like that caregiver's grief. And there's a whole bunch of resources in regard to just how does this affect you as a person walking with someone down grief when you're not the primary griever. That is really heavy too. So I just wanted to mention that.
Yeah.
All right. Do you guys have any other final thoughts, or do we feel like we can leave it there?
I do not.
I feel like that's good. Yeah. So take away from this, I'm going to scoot closer so I can stop it, that if this is something that resonates with you, you can start small. there are a lot of opportunities or ways that you can support both your team and your clients that I think really, really could be an impactful and important thing for you and your business. So I will sign off now. We will give the Unfiltered wave, the official wave. So thank you for listening, and thank you so much to my special guests, Kira and Sammy, today from my practice, who so graciously were voluntold that they were going to do this with me so that we could share this information with you. But thank you all so much for watching, and keep an eye out for more Unfiltered Vet Discussion podcasts coming out every week.